Welcome to our presentation. In this presentation, we will be explaining trends in the healthcare industry to identify opportunities for digital transformation and how it could be implemented in hospitals' emergency department. So what is digital transformation? It basically refers to how businesses leverage technology to create a new way of engaging consumers that disrupt all aspects of business. Together, digital transformation allows businesses to improve efficiency in the long run, creates value for customers through enhanced consumers' experiences and better service quality, as well as to empower employees by allowing them to make better decisions. Although digital transformation is a long process, it is inevitably essential to businesses' sustainability in today's digitalized environment.
We have compiled a simple SWOT analysis. We found that the healthcare industry and especially emergency service have shown a lot of weaknesses. Even though the current emergency service model is considered as functional, however, with the shortage of health professionals, long waiting time for treatment, and outdated data storage system, the emergency department is expected to crumble if no further changes or action to be done. Aging population has always been a threat to Australia, with the population of 60 plus expected to triple in the next 20 years, while the increasing cost in the health industry is expected to be putting a huge burden to the government and taxpayer. However, with the increasing public interest and openness on the use of technology for medical purpose and e-health record in place for over 20% of the population and growing, we can see a huge opportunity in how data analysis and the use of mobile device can help to disrupt the health industry.
We have identified three trends in the healthcare industry. Firstly, there has been a growth in the researches in the mobile-based biosensor and how it could be used for medical diagnosis, especially in resource-poor environment. Secondly, healthcare services providers are leveraging digital technology and cloud services to create platforms to link the entire healthcare ecosystem. Thirdly, increased investment in artificial intelligence allows better hospital and consumers communication and make information more accessible for both parties.
We would like to achieve four things. First, we would like to reduce the waiting time by improving the efficiency and the flow of the department. Our goal is to also cut costs by improving the allocation of resources. Thirdly, we are hoping to optimize pre-hospital communication, especially for ambulance management. And finally, we would like to help healthcare profession to make faster and better decisions.
Now let us look into the existing customer journey at the Emergency Department in Australia. There are two possible admissions to the Emergency Department, either as walk-ins or through ambulance services. All patients will then register upon admission to be assessed manually depending on the degree of emergency and be put in line for treatment. Most patients will then go through preliminary screening performed by nurses and given instruction for further checkups. Lastly, patient will move to the treatment stage and get examined by a doctor. With the goal to improve customer experience, we propose to implement Microsoft Translator Speech API and Microsoft Azure on a shared platform together with EHR to target emergency department staffs and consumers to improve pre-hospital communications. The first part of the strategy is to leverage Microsoft Translator Speech API. Nowadays, the paramedics from the ambulances will call the hospital to report regarding the condition of the patients on the way to the hospitals. Nurses at the hospital will note down using pen and paper the incident that was described by the paramedics from the ambulance. This allows nurses at the hospital to prepare what kind of procedures they would need to take as soon as the patient arrives at the hospital. We propose to replace the pen and paper communication method with speech translator, which allows paramedics in the ambulance to record the incident happened and get immediately translated into words and sent to the hospital digitally. This information regarding the patient's condition will automatically store in the hospital system where nurses can access them to get an understanding of the situations on the shared platform. Also, a recording of the speech by the paramedics will also be stored as a backup.
As mentioned earlier, with the shortage of health professionals and increasing amount of aging population, there's a desperate need for change to better allocate resources to improve efficiency. We're hoping to create a platform that will completely eliminate the need of registration, as patients would be able to register on their way to hospital. We would also introduce Microsoft Azure in the process, applying machine learning algorithm to the existing data from hospitals and individual e-health records. We're hoping to create a predictive analysis that will be able to predict patients' emergency level and perform preliminary assessments just by patients picking out their symptoms from a pre-designed list. Therefore, 30% of non-urgent and semi-urgent patients could be filtered out from the preliminary assessment and will be immediately diverted to wait for medical checkups. In terms of optimizing operations, the proposed strategy can reduce patients' waiting time by 40% due to the shortening time in registration and preliminary screening. The proposed strategy would essentially improve forecasting in the demand of various services, including bed space, nurses needed for wound dressing, or X-ray services. Hence, this could lead to a more efficient system and will eventually reduce waiting time for patients overall.
The proposed strategy can also empower employees as they better allocate human resources that allows them to focus on service quality. This is done by reducing administrative work of healthcare staff. Due to replacement of manual registration with digital registration, 30% of the patients will go directly to the medical checkup stage, depending on their circumstances. This prediction allows nurses to better allocate hospital resources in a timely manner. Again, it reduces the workload of nurses at the preliminary assessment stages and therefore allow them to better focus on healthcare service quality. The strategy also forges better communication between consumers and nursing staff due to increased accessibility to patients' information in a timely manner. Nurses are able to have a better expectation to what situation they will be dealing with and be more prepared. This may bring to a less stressful environment that may improve employees' morale from job satisfaction. The strategy is based on a platform that could be accessed on any mobile devices. The platform pocket-sized healthcare management as a platform leverage EHR that could be used for forecasting. The forecasting function on the waiting time could reduce frustration during the wait as consumers are more aware of how long they will be waiting to be treated. Also, the enhanced service quality due to staff empowerment and efficiency could lead to greater consumer satisfaction. The ultimate goal of digital transformation is to sustain businesses in the long run by putting consumer experience at the heart of the transformation. The proposed strategy creates a shared platform for hospitals' emergency department that could not only optimize your operation, but to empower its staff and engage consumers that could create value by improved efficiency in the long run. Thank you for listening.